Okay, so now we're going to move into the fourth portion of a spinal care class. But let's just have a little review. The first part is to explain to a patient what chiropractic is. It's about the central nervous system, and the central nervous system conducts electricity. The second part is about the spinal curves, how they develop and what they relate to. The idea with that is that as the patient begins to lose their spinal curves, as in anterior head carriage or flattening of the lumbar spine, in other words, when a person goes from a normal human position like this into this position, this causes a loss or reduction in awareness, and this causes a loss or reduction in the ability to participate, but also in drive. So if you think of teenagers that are sitting like this all the time, or people that are possibly chronically depressed, right? So that's what you want them to take away with. You want them to take that away with themselves. Okay, so the next part. Okay, so we have the central nervous system, we have the spinal curves, then we have the ergonomics. And so with ergonomics, you want to cover beds, pillows, chairs, car seats, desktops, anything that you can think of that's causing a distortion and a deformity of the spinal curves. Now we're going to move into the fourth part, which is, this is a place where you are allowing the patient to see into the inside of you, why you became a chiropractor, or what has totally inspired you about your work. It really shouldn't take more than about 3 minutes, where you want to tell your chiropractic story. Or it could be a story of a patient. It doesn't really matter. What matters is that it's told in a way that's very real for the patient and that they have an emotional response. So at this point, you're wanting them to be feeling rather than thinking. And so you're telling them why you do what you do and why it means to you, why it means what it does to you. And yeah, you don't need to be dramatic, just be translucent. Then the last part, so that's like the fourth part. So that has to be your story, not my story. I have several stories. And you just want to start gathering information and feelings and experiences and decide what is your story. And it may change through the years or even through the weeks. The last part is giving patients an opportunity to sign up their friends and family. So I'm going to kind of skip to that part and show you how I did it in my practice. So we'll do that next. So the fourth step, where you're talking about your story, is just something that you guys are going to do on your own. So now we'll move to the fifth step. You ready?